Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. What is irritable bowel syndrome with constipation IBSC? Constipation predominant irritable bowel syndrome, IBSC, is a condition characterized by chronic constipation with associated abdominal pain. /r/n/r/n It's a subtype of irritable bowel syndrome IBS. About 1/3 of people with IBS have the IBSC type. /r/n/r/n IBSC is a functional gastrointestinal disorder. These are gastrointestinal, GI, disorders that produce symptoms but have no identifiable cause despite standard diagnostic tests. These disorders can cause significant distress. /r/n/r/n Diet changes, fiber supplements, medication, and behavior changes may reduce the symptoms of IBS with constipation. Some people also try the lowFODMAP diet to know which foods to avoid for symptom relief. /r/n/r/nrbazon, Getty Imagesrnrn The main symptoms of IBSC are frequent constipation accompanied by abdominal pain when having a bowel movement. /r/n/r/n It's normal to have 1 or 2 bowel movements per day, or not to have one every day. Characteristics of constipation include /r/n/r/n The Rome 4 criteria define IBS based on specific signs and symptoms. According to these criteria, IBSC is specifically defined as a condition in which /r/n/r/n in addition to the Rome 4 criteria for IBSC, you may experience other symptoms if you have constipation predominant IBS. /r/n/r/n Common symptoms of IBSC include /r/n/r/n Loose stools rarely occur with IBSC, unless using a laxative. /r/n/r/n IBSC and chronic idiopathic constipation, also known as functional constipation, share many of the same symptoms. /r/n/r/n According to the Rome 4 criteria, the biggest difference is /r/n/r/n Gastroenterologists question if the two conditions are manifestations of the same disorder along a single disease spectrum, rather than two separate disorders. /r/n/r/n However, the two conditions respond to different treatments. This suggests they may be two different conditions. At this point, the answer isn't clear. /r/n/r/n There is no known cause of IBSC. The symptoms occur because the digestive system does not function as it should, but there is no identifiable cause for this. /r/n/r/n Dyssynergic defecation, which is dysfunction of the pelvic floor muscles, is often present in people with IBSC. /r/n/r/n IBSC is traditionally a diagnosis of exclusion. This means that it's only diagnosed after ruling out other disorders that may cause your symptoms. However, diagnostic guidelines released in 2021 by the American College of Gastroenterology, ACG, aim to make it a positive diagnosis instead. /r/n/r/n The ACG says its recommended diagnostic method will make the process faster and get you on proper treatments sooner. It's not clear how the guidelines, explained below, will change your healthcare provider's IBS diagnostic process. Either method can diagnose you accurately. /r/n/r/n If your healthcare provider suspects IBSC, they'll likely /r/n/r/n Other tests may be recommended depending on your symptoms and medical history. These include imaging tests and interventional tests such as colonoscopy. /r/n/r/n If your symptoms match the diagnostic criteria for IBSC, and there is no evidence of any red flag symptoms or other illness, you can be diagnosed with IBSC. /r/n/r/n Rather than doing extensive testing, The ACG's recommended diagnostic method includes focusing on your medical history and physical exam in addition to key symptoms, including /R/N/R/N. No further testing is recommended for IBSC. /R/N/R/N. The ACG treatment protocol for IBSC includes diet modifications, supplements, prescription medications, and lifestyle and behavioral changes. /R/N/R/N. The ACG says some common IBSC treatments don't have enough evidence of effectiveness to be recommended. These include /R/N/R/N. The 4 types of IBS include :/R/N/R/NIBS is a chronic condition with periodic flare-ups. The flare-ups depend on various factors, but can last anywhere from a few days to several months. /R/N/R/N. Some people find relief with IBSC if they avoid high FODMAP foods, such as :/R/N/R/N/R/N/R/N. You can also try avoiding carbonated drinks, sodas, caffeine, and gas-producing foods like broccoli, Brussels sprouts, and beans. /R/N/R/N. However, dietary triggers depend on the person. Some people are triggered by certain foods, while others are an /R/N/R/N. Talk to your healthcare provider first, but laxatives are the most common medications used to improve bowel function in IBSC patients. /R/N/R/N. rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.